Now, with more than 20 million confirmed coronavirus cases in the US, there's a ton of concern about the vaccine rollout, the pace of it. Now, the head of President Trump's Operation Warp Speed has said that the US is considering possibly giving half the Moderna vaccine dose because apparently it can be just as effective as 100% of the vaccine dose to kind of speed up immunization in the country. Now, we're getting some breaking news out of the UK where the Prime Minister Boris Johnson there has announced a new national lockdown. I want to bring in Yahoo Finance's Anjalee Khemlani to break this all down for us. Anjalee, many of us are concerned about the pace of the vaccine rollout because we would like to avoid another national shutdown, kind of like what we're seeing starting to happen in the UK. So, what is the latest here?
Right. So let's start with the UK news first. Obviously, that has been a concern as we know that that new strain is highly transmissible. We've seen the graph of the UK cases just shoot up in the past couple of weeks. And that's causing a lot of concern as we know that that strain is also present in the US. And so, in an attempt to really curb the ongoing transmission of not only just coronavirus, but that specific strain, we also know that the South African strain is also a concern in other parts of the globe. So we're seeing these mutations, these variants take course, and that is causing a lot of concern about the pace of vaccinations right now. We know that the US is less than 3 million vaccinated. I'm sorry, they did update that number a little bit earlier today. So we're on pace to increase vaccinations, but not at what it was supposed to be. Initially, the federal government had said we'd get 20 million vaccinated by the end of last year, and that hasn't happened. We also know that there have been delays in really the rollout. A lot of people saying that it's really up to that last mile. And so a lot of questions about what can be done as well to ensure more vaccinations in the process as we see more need for the vaccine pop up. That led to Moncef Slaouy's comments yesterday on CBS Face the Nation, which includes having the dose. And that could be from Moderna, specifically the company that they're most in touch with, but could also include Pfizer. And those two specifically, because the mRNA platform did show the highest amount of effectiveness in the clinical trials. And so they're using that data and analyzing it right now to understand whether or not they can have the dose. That was a conversation initially as well on whether or not a single dose could be effective enough. But we know that the concept of a prime and booster is more effective. And so that's where the idea is currently coming from. Sabeel?
And Angela, I wanted to also ask about Haven, which was supposed to be this like revolutionary collaboration with Berkshire, JP Morgan, Amazon, where they were going to disrupt healthcare. Now we're getting information that they're breaking up and everyone's kind of going their own way. What's the situation there?
So that actually comes as no surprise to many of the health experts that I talked to. And in the beginning, when I was first covering, they're joining their formation, many people said that while as an employer entity and as three very large employers coming together to sort of, tackle the cost question, it's very hard to do because the market for healthcare, the healthcare systems themselves are so complex that just one entity can't do the job. And that seems to be what sort of ended up happening. So no one is surprised, but we are waiting to see what happens. Simultaneously, we also have to remember that the Trump administration has really pushed the conversation forward when it comes to price transparency, and whether or not the Biden administration picks up on that and pushes it even further will also play a role. So no surprise there. Employer healthcare, still has some potential because of the size and volume that employers have, but because of the construct, the framework of the healthcare system and its complexities, many health experts say this was doomed from the start.